Hello and welcome to our Friday webinar. We are back with Dr. Tom Tully for an episode of Ask the Vet. Welcome, Dr. Tully.
Well, hello, Laura. How you doing over there in
I
California?
am less rushed than you are. My Friday's been pretty chillax, and apparently you just came from surgery. So
Yes, just in time, actually, and all's well. Yeah, I'm glad that everything it was perfect timing.
was it
So
an avian patient?
yes, it was a goose, actually.
A
Yes.
goose. Okay.
Yes, had
A
some
pet goose?
masses in the face, so had to remove those and was a little bit more involved than anticipated when I started. It was like, well, but I did have an idea that it could be a little difficult, but no, we got the masses out. So yeah. So
Wow.
that's what it was. So goose, and hopefully it does well from here.
That is fascinating.
Yeah. So
All
been a
right.
busy day, which is
Yes.
good.
Yes. You took care of goose. It's more than I can say. I've done anything that contributing to the better of anything today yet. So that's inspiring. So just a reminder, everybody, if you're joining us, if you have a question for Dr. Tully, to use the Q&A button, not the chat feature. And so Dr. Tully, I feel like it's been forever since we've had you, but it hasn't. But I just as we wait for people to log in, I just wanted to. I haven't actually. Let's see. I don't know if anyone has met Dr. Tully in person, but just to give you an idea, he is very, very tall. I mean, you can see that. It's Dr. Tully at a vet conference. Is that the chair is you're
It's a mini chair.
you're the giant in the regular
Yes,
chair.
I'm 8'2". I'm shack size. Yeah,
Yes, you must have played at LSU because our
yeah,
yeah,
LSU. There's the LSU connection right there.
that's Dr. Tully in the tiny chair at a vet conference. Just thought you
Yes,
I love that photo.
very much so. But yeah,
Hopefully it didn't
that was, yeah.
it didn't, like it didn't break, right?
I
All
love
right.
it.
That's really funny. Yeah, Brenda just I love it. Brenda says when what happens when you order chairs from Amazon and you forget the check the dimensions. Okay.
I'm gonna leave it at that, but it was comfortable. Let me tell you, Brenda, that's good. It's comfortable. I wasn't complaining. Did you see me? I was smiling, so
Right. Right.
yeah. So
Okay. Sorry, that was a good way to start.
yeah.
Okay, let's see what we got here. We've got some people that are coming in still. So
Yeah, we had it's always never a dull moment. I mean, we just had that surgery with the goose, and we have had some different patients come in, but I always want to remind everybody about birds and other animals. If they're out, you want to be very careful. That definitely keeps us in business, unfortunately, and hopefully we can actually treat the animal to resolve it. We've had a couple that we haven't been over the last 2 to 3 weeks, but cat bites. Just had a call about a dog bite on a bird. I mean, that makes for interesting video for Instagram and Facebook, and it's cute. My wife likes to look at them,
yeah.
but they're okay until they're not. That's and it only a dog will bite like that. I mean, it's so quick that you won't even know what happened, and then the bird is injured or dead. So just be careful and try to make sure everybody knows about that. And just because you see it on Instagram and the bird riding the dog or they're kissing or whatever,
Yeah.
that is until it isn't. But we're here if that happens and do our best, and just and hopefully, and that's also for other birds to birds. We get that. One thing about that, and the bird never learns. The bird never learns. I mean, it'll go to the cage with the eclectus, a small conure to the eclectus or the macaw. It'll bite half the beak off, and then that's bad enough. And then, 6 months, maybe a year, 3 months later, it goes back and it bites the rest of the beak off. So don't think that the birds learn, because they're not. So, but anyway, just something, as people kind of getting on. But I just, we see so many cases like that. I just want to try to remind everybody, and I know how much they're liked on Instagram and Facebook, but it's dangerous.
I just saw an owl and a budgie hanging out together on Instagram, like an owl and the budgie's like preening his facial feathers.
Yeah. Yeah. Well, I don't know if the owl would see that as food, while nobody's looking, but no, no.
All right, there we go. Yes, those are all very good to keep in consideration when you have animals with mix in with other animals. We got a question from Adam about regarding allergies. Okay, here we go. How does one distinguish if the cause is dust allergies to a specific pellet, food, or some sort of pollen that comes around once a year? So are there certain specific symptoms to watch for? So how can you tell? Is it dust, allergies to food, or something else, pollen?
Well, that's we did a few. I considered it relative to what's out there, quite a bit of research with that, and I think I mentioned it before as far as it relates to allergies or an allergic reaction, the hypersensitivity, I guess you would want to say, because there's about 4 different types of basic types of hypersensitivity, and so we were looking to see if if we could test for that, just what you're asking, because we fully believe that birds are no different, and that they could be hypersensitive to and have allergic reactions to allergens or within the environment, or ingesting, just like other animals. And so, of course, there's skin testing to test for mold, and to test for pollen, and to test for different types of pollen and grass and things. I mean, if you have a dog and it's like, it's allergic to grass, like, whoa, what do you do then? But there's medications and things like that, and how to try to mitigate the problem. However, in birds, we have such little small creatures, and you can't like pluck feathers to do a skin test. So we were looking to see if we could do skin testing in birds. And what we found is that you could, but the problem is that the results of the test were affected by a number of things. One is we had a small sample size because you had to do it on featherless tracts, featherless areas of the body. And then also you have a very thin skin. So you can do an intradermal injection, but the problem is that the skin is so thin, just giving the injection causes inflammation. And you're looking for inflammation as it relates to the allergen that you are testing for. So pollen, what have you. So if you don't, so that means that your control, your saline control would have it'd be difficult to tell between a subtle reaction from an allergen and the control. So that was the problem with birds. And you can do it. Possibly in the future, there would be some way to take what we found and try to develop it when new technologies come out. But then your question is that how do you determine what it is? Well, unfortunately, there's really no way to determine that. And so if you suspect that there is an allergen, that it's hypersensitive to something within the environment, what it's eating, what have you, then the only way that you can do that is to try to take what you believe may be it. If it's a food, change the food. There is hypoallergenic foods. I know that I'll think of it, Laura. The name escapes me right now. Out in California, a name on the tip of my tongue. And I'm thinking of every food company, but anyway, there's hyperallergenic foods out there, but also just changing the food. It may be something within that formula that may be causing it, and that would help with that instance. If you feel like it's something within the air, that's going to be a little bit more difficult. If we've had seasonality, and this is a great question because it's something that's it's frustrating when it happens, but we've had birds that would have feather destructive behavior every November 2nd, the week of November 2nd or the 1st of November every year. And is there something in the air at that time? Is there, and so the only way that you can look at doing that, involved with that, is to one is to try to kind of reduce the exposure as much as you can, but you can't reduce all exposure. And then if it has consequences as it relates to feather destructive behavior or something like that, then go ahead and have some preventative medicine to try to combat those signs. So you don't really know, and there's no way to determine that, but you have to look at trying to do what you can to rule out what possibilities there are in the larger picture of what the bird could be having these hypersensitivity reactions to. So there you go.
Okay, just want to know your opinion on birds being allergic to other birds. So if you have a New World species versus an Old World species, like if you keep a dusty species like a cockatoo and house them near an Amazon or a macaw, could that cause any kind of
I don't see why not, because it's medicine, right? It's not like, well, birds are special. We don't get those type of we don't get those reactions because this is a foreign material, and if the bird is inhaling it, it's dependent upon how their body system reacts to it and can respond to it. And no different than many people have seen people that have been allergic to rabbits. As soon as they're in the room, they just boom, like, well, how many people can have rabbits and don't react to it, right? Then you can also develop over years. Somebody cannot have a hypersensitivity, and then they become allergic, right? Over time. Our veterinary nurse is allergic to rabbits, but not severely. But you can definitely tell when there's a rabbit around. So, that's, question is, I don't see any reason. That would be a variable that you would want to try to kind of rule out, But the gentleman that I think that had the question was mentioning seasonality, and that's and of course that wouldn't be a bird. But with your question, yes, I don't see any reason why. Physiologically, that wouldn't be the case. And obviously, you've been around birds, and birds have been, together, and we haven't had any difficulty. But that's just like most people. Most people aren't allergic to the same thing, and it's there's allergic to some things more than others. There's just not been a lot of research in this area, other than, like I said, some of the stuff that we have done. They've had some work in Australia. I think Dr. McWhirter in Australia has done some work on that, on hypersensitivity, and pathologists have, because it was one of the things, can birds have allergic reactions? Can they have hypersensitivity? That was a question that we were faced with. See, we've come a long way over the years in avian medicine. Now, this was in the middle 90s, but it's still last century, right? And so, do birds get hypersensitivities? And it's like, well, why wouldn't they? Are they special? They are special, but physiologically, I didn't see any reason why they would be, and because they've had hypersensitivity reactions. It's been known for years that they've had vaccine reactions and things like that. So there's no reason that they wouldn't have these type of reactions. And so the pathologist said, yes, the cells and the tissue is all consistent with hypersensitivity reactions. So there you go.
There you go. Okay, a question from Amy. She has, have you ever treated any cockatoos that will intentionally prolapse? If so, what treatments, if any, have you tried?
Intentionally prolapse? I think most of them are intentional. I don't think it's like, oops, I didn't do that. I think that they strain. I mean, I've had African grays that, and that's the whole thing. They're straining to get that cloaca out, and it's so much so. That's why if you do a surgery, and it's a great question. I don't know if I've ever treated any that have been unintentionally prolapsed, unless it's an egg, kind of a prolapsed cloaca that's associated with egg binding or dystocia, whatever you want to call it. But the majority are when the birds are straining or pushing that cloaca out due to amorous behavioral kind of feelings, for the lack of a better word. And so no, so that's what that we normally treat. Now, if it's and so I don't know if the question was, now that we've talked about it for a little while, was it treatment for involuntary or voluntary?
I think it's treatment for voluntary.
For voluntary. Well, that's that's the majority of our problems that we face. And so, yes, there's a multitude of treatments for it. For most, many, with the prolapse cloacas, there's a number of reasons why the cloaca can prolapse, just like a prolapse rectum in a mammal. There's many reasons that can occur. One of the kind of made, like in cockatoos, one of the ones that people kind of gravitate to is the kind of mating behavior and amorous behavior and stroking and encouraging, and it's hard not to, because cockatoos are, and many, they just want to be, as I always say, Chris Davis, a cockatoma. They want to be attached to you physically, and so it's hard to push them away when you have unconditional love, but I can tell you that it can get overbearing in a sense. But a lot of people, it encourage, and the petting and the birds will go from masturbating or and I've seen that to the rubbing. They will have a different stance, and so they'll do this, and in the process the cloaca, they will put pressure, and it would, and it's been proposed, and that encourages the cloacal prolapse. Now, so how do you treat that? Well, one is you treat it's a behavioral issue, and so you have to treat it as a behavioral issue and try to discourage the interaction that encourages the cloaca to prolapse. Then also what you're looking at is that you can do hormonal therapy with implants, but again, that a lot of times doesn't last very long. It may prevent I know in some of the cockatoos we've used, it may prevent it for a month or two, but then there it is, it's back again. Then what you do is you look at, then you look and see if there's any underlying reason besides behavioral. Is it possibly a parasite problem? You don't have many parasite problems in pet birds, but it is possible that could be that's causing that intestinal tract to move really quick, and so kind of like a hypermodal intestinal tract, and that will cause it to prolapse. You can almost put that under unintentional, but you don't know initially if it's unintentional or intentional. So you have to do your due diligence to see what's the underlying cause. If it could be a medical problem that could be treated, like parasites, boom, that's it. And if it's prolapse, go in and put it in so it can heal on that. And so you can have bacterial infections, something that may cause it, and also there could be tumors or that would be associated with that. So those are just some of the things that you would do. So you could treat it and try to and get it resolved in that way. And like I said, behavior, the hormonal doesn't work, and so optimally if you could in many times in females, that if you could remove the ovary, that would be the best, because you remove that hormonal effect. But unfortunately, that surgery is highly it has a high risk, and not many people will be willing to do that surgery. I wouldn't be willing to do the surgery. We had Dr. Avery Bennett here, and he would, but again, he's a board certified surgeon that wrote the book on avian surgery, right? So that's the type of people who would be doing that type of surgery. But if you did remove the ovary, that would solve the problem. And then, of course, you have the situation of fixes. And when I say fixes, you're just treating the problem of the cloaca. So basically putting a stopper in its booty. Okay. So the bird's still going to strain. You're not resolving the issue, but you have plugged up the problem. Okay, so you can put a purse string suture. You can do actually do a what they call a pexy, where you take the cloacal tissue in the cloaca, in the body, and you can tie it around the ribs. And so you're stitching it back, so you're pulling it in by suturing it to the ribs, right? With suture material. So it's a loop, and you have it into the cloaca and on the rib, and then so it stays in. So it can strain, but it can't come out because you have it sutured. But the problem there is that it will break down. Eventually, that straining will break that tissue down. So it's not, it may work for a year. Usually probably 6 months to a year, you can count on them, but it may last a little longer, 2 years, but it will break down. The purse string suture is a problem because you want to make sure that when you put all that tissue back, that the bird can defecate, okay, and urinate, and that you just hadn't put a, it's called a purse string because you cinch it up and you don't want anything coming out, but you have to have the poop and the urine to come out. And so you have to make sure that that's the case. And if you don't, if you're not watching that, then and it gets, where it can't poop or urinate, then the bird becomes toxic. So that's a problem. But if it's done right, that can give you a short-term situation, but you're only treating the problem. There's a couple of surgeries that you can reduce the diameter. And that's kind of one of the surgeries. Dr. Beaufrere, when he was at Toronto and Ontario Veterinary College, kind of did an article on this surgery where you have a cloaca. You just take the cloaca and you reduce the size of the opening so it can't prolapse that way, and so it's kind of a half. And so this is another surgery, his technique, and find another one where you just actually remove tissue, like you have a circle and you reduce, you just cut out part of the tissue and you just make it heal smaller. And again, that solves the problem. I mean, it solves the problem, but it doesn't treat the underlying cause. So that's the one thing that you're looking at. And I would say that topic and that question deserved every second that I gave on it, because it is one of the most frustrating presentations that we have, and it is not an uncommon presentation. Yeah.
No, it's good, because we do get that question quite a bit, especially it seems.
Yeah.
Okay, we have one from Eileen about a 26-year-old lilac crown Amazon that was diagnosed a couple years ago with atherosclerosis, and is on okay, here we go, anapapril and
pentoxifylline
and isox twice a day.
Azoxaprine.
Okay, thank you for. And then 6 weeks ago started with severe leg pain and balance issues. So the lab positive antibodies for AGN, ganglioneuritis, on 4 doses of Onsier and now on Celebrex twice a day, almost back to the baseline. So questions are, will she be on Celebrex for life now that she's better? Or, sorry, I have a little gnat here. What is the prognosis as she's had neurological but no GI symptoms?
Yeah. Well, I'll go with what I know on this. So atherosclerosis in this lilac crowned Amazon, 26 years old. So it's been diagnosed with it, and I would count that it was diagnosed with it. That the veterinarian has seen evidence of such. The Soxaprine, the enalapril, and is mainly cardiac function. That's not necessarily going to affect anything good or bad with the atherosclerosis. But it will, if there have been cardiac issues or concern with the cardiac function, then itself, then then that would be the case. The pentoxifylline is a drug that there's been a little bit more information on some of the cardiac medications as it relates to birds than some of the others that you've mentioned. When you're looking at the pentoxifylline, I don't know if there's any evidence that it how effective it is, but we'll prescribe it because it again encourages vascularity. So atherosclerosis is really coronary heart disease, where you have blockage of the arteries, and when and cardiovascular disease, I guess, would be a better way to describe it, cardiovascular disease, because it is basically the blockage of the arteries, calcification, hardening of the arteries. What you've heard in humans, where they put stents in and they do bypass surgery because the cardiac vessels are clogged, for the lack of a better word. And so then you have this situation in birds where it's not only affecting the coronary arteries, but the birds don't seem to die often, because we just don't know how often birds do die from like a coronary, where the coronary vessel, the vessel on the heart, is like blocked and it dies just like a human. But it affects birds, their aortas, their big vessels, and it'll affect the brain vessels. Birds will get strokes due to blockage of the arteries. And so that's what atherosclerosis is. It's not necessarily, it can affect the heart function, but in and of itself, we've had birds with atherosclerosis with no cardiac anomalies, based on our cardiologist evaluation, not mine, but our cardiologist here. So it appears that you not only have atherosclerosis, but you're also getting the bird treated due to with cardiac disease. But that's okay. And the pentoxifylline is used because you have these blockage to try to encourage vascularization. So neovascularization or new vascularization, or help with the blood going through the body. And that's what the pentoxifylline is being used for. Now, then we get into this situation of where the bird is having difficulty, it's having these episodes or what have you, and kind of difficulty perching, climbing, something of this nature. And so then you get to this, you said that it did some kind of test. What was that?
Let's see, they're back to normal. So they oh, so 6 weeks ago they what did they do? Started with severe leg pain and balance issues, and the labs are positive antibodies for AGN. Did we cover that? The glandulitis.
Yeah. So okay, just hold there.
Almost back to baseline, it seems.
That that was proven by Dr. Ian Tizard. Well, I mean, proven is a kind of a big term, but Dr. Ian Tizard, he was a immunologist, and he actually did research at Texas A&M on that AGN antibody, and found that there was no correlation. This was in a 2017 paper between this antibody and the proventricular dilatation disease. And I don't know of anything that's been really, published that has been able to refute that of significance. And so at this point, I don't know what it means based on Dr. Tizard's work there. And then you have a 26-year-old Amazon that has atherosclerosis. And so you have a situation where you have blocked vessels that have obviously been identified. And that what happens is that is more likely is that the atherosclerosis is a causing a blockage of the vessels. It's called claudication, where the vessels get blocked, the arteries, especially when the bird gets has higher blood pressure, and you can get higher blood pressure, of course, that's why the older you get, your arteries just aren't as, flabby. They're not as, they don't have as much elasticity. Okay. They get like hard. We're old arteries, even if they're not blocked, they just don't have that elasticity. And so that's why the older you get higher blood pressure usually, because you just don't have that elasticity, whether you have significant atherosclerosis, which probably some, percentage of that, but it may not be significant, but the vessels just get they get hard. And so anyway, the higher blood pressure. And so with that, and again, this could be why some of the drugs that the bird's on. And then what you have at that point is that claudication, high blood pressure, the blood is trying to get through the veins quickly. And what happens when you have a small opening and you have a lot of people trying to go through it quickly?
Yeah.
Right. They don't all get through, and they get crushed, and they just, and so that's what the blood's trying to do. All of these red cells are trying to get through there quickly, and the higher the blood pressure, it just can't get through there, you see. And then all of a sudden, what about all the tissue that's behind that, in front of that? They're saying, we want air. Well, then they don't get it, because that's what happens. And then what happens then is that there all of a sudden is dysfunction in the legs, right? It's a known condition, claudication. And so this would make more sense to me based on your history than well, I mean, I don't even know what that antibody, I mean, it's a test, but I don't know what it means based on Dr. Tizard's, because there's no correlation on that. So could it be? There's a chance. There's a chance. But what we do in medicine is try to go along with the most likely scenarios. And then you have the Celebrex, which Celebrex is the drug that has been shown on proventricular dilatation. There's no evidence that the bird has proventricular dilatation, but at 26 years old with atherosclerosis, it probably has arthritis. So that probably makes it feel good right there, but not, of one part or another. Then what you have is this Onsior, okay? Onsior is a non-steroidal anti-inflammatory, just like Celebrex. It's just a different type. There's many of those out there. One of the proponents of Onsior is that it can be given in weekly intervals, or there's been published 3-day intervals. And their only problem with that, and it's been being used for, I don't know, we're going on almost 8, 9 years. People have been using it. There's not many studies. We're going to do a pharmacokinetic study within the next month on it in our parrots. But there's been a swan study, and they prescribe it every 3 days, every week. And from what is a swan study, the amount of time was I think less than an hour that it was at a therapeutic, effective therapeutic dose that they knew. Now everything's different, but that's the only evidence that we have out there other than, whoa, it works. But then again, for years we thought that phenobarbital was a great anticonvulsant medication in African gray parrots. Oh, whoa, it stops convulsions in African gray parrots, seizure activity. Give the gray, oh, yes, it works. Yes, it does. And then all of a sudden, and it was oral medication, and I can tell you, people to bet their lives that it worked. And then we did Dr. Beaufrere and Dr. Lauren Powers about the same time said, it doesn't seem to be working in this gray that having seizure activity. And then so they independently, but it was about the same time. It's just like planets aligning. They did they actually submitted the blood work and see if there was any form, any phenobarbital level in the bird. There was none. It doesn't even, it's not absorbed in African grays and may not be absorbed in other birds. You can only say African grays, but yeah, but people would have said, wow, it really works, but they're doing all this other stuff too, right? So what was actually working? But and so we have Onsior here. People are going, man, this is great stuff. Man, I'm seeing just great results. And the only evidence we have is it lasts less than 1 hour in a swan. We're going to see what it does in Hispaniola and Amazon parrots, but the metabolism in cats, I think it's used more different than birds, and we have species differences. But so at this point, I don't see. I mean, I'm not using it until we find out more that we can say that we're actually getting therapeutic levels, because all evidence at this point is just like it works good, just like the phenobarbital did. It's a miracle, but that's something that try, and so not to say it's not, if somebody says, hey, I don't care what Tully says. I don't care. It works. Great. But I've just kind of given you a background on some of the things that we go through. We just don't have all of the background information, and we do the best we can with what we have, and we look for treatment responses. But you have to also look at what's out there and think about the bigger picture, and try to use as much objective data as you can to make decisions. So that was a great question. Had a lot of just different aspects of but very common things. And we've had a bird very similar to that present. It wasn't a lilac crowned Amazon, but anyway.
Okay, that was very thorough. Got a question from Susanna. Asks, what can be the reason behind a fluid accumulating somewhere in the body cavity? So specifically, for example, behind the liver of a female Indian ringneck, how to treat it apart from draining if it reoccurs. So we've got some fluid building up behind the liver of a female Indian ringneck. How do you treat it, and how do you drain it if it happens again?
Well, one of uh, the things, well, with fluid, well, you have the coelomic cavity, and you have different, for the lack, again, compartments within that coelom that are not within the respiratory system and or the air sac system, where you have a where you have the stoma, you have the air sacs, and it connected to the lungs, which again, the bird's body is basically all a respiratory, system. Okay. But there are areas in that are not within the air sacs, and fluid accumulates. Like one of the most common reasons that we have fluid within the body cavity is what we call internal ovulators, where birds ovulate into the again, they ovulate into the body, and then when they get into the body, you have these big ova, and that causes inflammation. That's it's the yolks, right? Think how big the yolk is compared to the bird, right? And it's kind of free floating within the body, and so that can cause buildup of fluid in there, and naturally then that would have to be to you drain it. I mean, we have that occur in chickens quite a bit, and then you can have it in parrots and a number of birds, even ostriches. And so that would be to kind of treat the reproductive issue and try to kind of have ovulation shut down so that does not occur. But you would work on it reproductively. Now, also, you can get fluid build up due to tumors. Tumors, unfortunately, that raises its ugly head. But tumors can cause fluid buildup due to constriction of vascularity or tissue that would cause the buildup within the body cavity. And so that's another issue that would possibly cause that fluid to build up. Also, I guess you could also have some type of inflammatory condition within the body due to an infectious process that would be affecting some organ or tissue that would possibly cause a fluid to build up. So those are some possibilities. I'm sure there are others, but the main thing you said, well, that's great. So then how do you diagnose that? Well, usually the best way to diagnose that is imaging. Okay. Your complete blood count, your serum chemistry panel, they can possibly identify an area or a magnitude of the problem, but imaging is probably your best bet to identify it, to see if what could be problematic. One of the things that you have in this type of situation, it's an Indian ringneck. It's a small bird, so if you're doing ultrasound on the bird, in birds normally, other than cardiac evaluation, echocardiography of the heart, then birds' body cavity is just not built for ultrasound because there's air in there, and air is the enemy of ultrasound. Now, sound waves aren't penetrating the air; they penetrate solid and fluid, but the air is not good. That's why birds are good for endoscopic exams, but not ultrasound exams. So the ultrasound exam, if there's fluid, that would be improved your chance of trying to identify a problem there. And of course, you're looking at CT. As I mentioned, you can, radiographs are good. And that may indicate, may show you something. But of course, computed tomography is well, you can 3D reconstruct the organs. You can look, you can see the abnormalities, what have you. You can take radiographs, but it just doesn't, of course, show you. It may be able to identify something, but not on the magnitude of CT scan.
Okay. Sorry, I was just an update. So they said that they had the fluid drained surgically because they were pressing on air sacs, and their ovulating organs looked okay to the vet. He didn't see a tumor, and an X-ray showed a large liver and ovary, and it turned out to be fluid. Is that?
So again, the ovary, it could have been, and then see, one of the things that's helpful to try to identify what's going on, and I'm almost sure that your veterinarian did this, is to take that fluid and get that assessed by a clinical pathologist, and the cytological evaluation of that fluid is often helpful into determining what the fluid is, and even may give you answers to what's causing the problem. It doesn't always, they can say that it looks like fluid from a internal ovulation. They can't say that that's what it is, internal ovulation, but they can say that's what it looks like, or you can interpret it as such. There's number of descriptions of that. But sometimes they'll see cancer cells in there, and they can identify that it is a tumor. But if this is a female's been laying eggs, has a history of that, then it is very it is highly possible that it could be internal ovulation, and it'd have to be treated as such. Yeah, good question. Thank you very much.
Okay, we got a question from Nan. Try to take my Amazon outside to the porch every day for sun and fresh air. Next door neighbor recently started backyard chicken coop with 5 hens, and they're about 20 feet distance between her cage and our porch, and the hens in their yard. Any concerns about the spread of any disease or anything like that? It's a good question. How far can a parrot safely be from some chickens?
From the dirty birds, right?
The dirty birds. Yes.
But and I say that tongue in cheek, because the chicken, somebody who has some chickens may think that the parrot's the dirty bird. Well, I'm listening to this because I want to keep my chickens away from the parrot, right? So it works both ways. But I think that's fine. I don't see anything that's going to be problematic between the chickens at that distance. If you had them in you had it in a hen house, and you'd probably be exposed. The one thing I'm trying to think, there's a number of disease conditions that chickens can have that we rarely see, and if any time in parrots. Not to say that they couldn't get it, but I think that's a great question. But I don't think that there's anything that no problem there. That's good.
Maybe the Amazon's picking up the chicken sounds.
Yeah, exactly.
All right, so we have a question from Ronald. Where can they find the most accepted diet for grays online pertaining to what they can and cannot eat? So they have 2 grays that seem like they like different foods. So of course it's a little bit challenging. They eat pellets, and One is assertive and likes to advocate to eat what they eat. So you've got two Amazons with different food preferences, and one likes to eat the humans, the human food.
Yeah, well, they're Amazons, not African greys.
I'm sorry, grays. I'm sorry.
I mean, I'm
They're
thinking,
grays. Yeah, yeah. Sorry. Thanks for correct. Yeah, African grays.
I mean,
Well, we were on Amazons earlier, so and Amazons have big appetites.
all the difference in the world, all the difference in the world. No, really, I don't think that anybody's done the daily nutritional requirements of African grays. There may be, but I just haven't seen it. But what you're, and again, there is a publication, Randall Brew, worked for KT, know really well, good guy, knows the stuff, nutritionist. They had a kind of a consortium of kind of recommendations on diet for small birds, and I'll try to next time. That's something that I got to do next time. Remind me to see, get the nutrition thing, nutrition, and I'll give you the information on it. But the consortium basically came up with a generalized, because everything, we have different genus, different species, different families, from cockatoos to psittacine, and so basic nutrition guidelines. And so and then there's also going to be an excellent nutrition article published in the Journal of Avian Medicine and Surgery that goes into depth on that, and I should have the information on that too. So for Halloween, the Halloween October, ask your vet. I'll bring that to it. But diversification, yeah, like I said, a pelleted diet, if you can do that, I've talked about that, and then I think that it's okay. But I've had birds, they look the same, all blue front Amazons. Each one had a different taste. Each one ate something different, and they all had the same thing. Maybe 10 different varieties of food. And it was almost like we were doing it just to give them diversity, but it was kind of a observational study. It was like, oh, well, you like the apple. Oh, you don't. You like and it's like, and they would go to it like that's what they wanted first. And each one, I mean, some were the same, but because we had about 20 at the time, because this was during when there were importation prior to 93. So anyway.
Okay. Oh, wait, I gotta announce today's giveaway winner. Sorry. We're giving away the limited edition banana Nutriberries. So they come in cool tin. Remember we did the banana unboxing together?
Yeah. Yes.
I would grab my little budgie friend, as he had some earlier today, and so it's in the other room. But that is gonna go out to Wendy. Wendy, congratulations. We're going to be sending out some Lafeber banana Nutriberries in the wonderful golden tin that it comes in, as well as another Lafeber product of your bird's choice. And wow, Dr. Tully, we just ran through that hour, or you did. So I was along for the ride.
That's what floats this boat here. The excellent questions and the excellent attendees. They're fantastic, and always good, always learn something. And I'll try to have that nutrition guideline information for October.
Oh, that's right. I cannot believe October is literally a couple days away. We're like practically there. Okay, so I gotta announce what we are doing in October. Let me find my my playlist for October here. Okay, so coming up in October, we have, what do we have? We have October is kind of like a theme here. We got the Avian Vet Insider with Dr. Lamb. She's going to be talking about geriatrics. So is my parrot a senior, and what should I do? So we're talking about senior citizens. I love to say that word. The gray way, we're going to talk about older grays. Let's see, and then we're going to Pamela Clark is going to cover translating parrot, choosing and adopting and bringing home an older parrot in October. And then guess what? We're going to be out with you, Dr. Tully, at the end of October. Ask the Vet. And I think, if I remember correctly, last October, sadly, we weren't able to see you in so close to the Halloween holiday in costume. So I can't wait to see what you drum up in October, hopefully.
Not scary enough like this, you know. So
We'll have
anyway,
to do some kind of like the scariest questions you've ever had, or some the
chair,
scariest.
tiny chair.
You have to show up in your tiny chair. You'd be like a giant. You should be like the Jolly Green Giant and sit in a tiny chair.
Yeah. So anyway, no, looking forward to that. Yeah, that's near the end. Spooky.
Spooky, yes. So all right, everybody. On that note, can't wait to see you again in October. Dr. Tully, thank you so much for rushing from surgery and that goose will be in our thoughts. I'm sure.
So
There we go.
doing well. All right. Well, thank you so much, Laura, Brenda, and especially all of the attendees. Great job. Thank you. And look forward to next month.
That's right. Wait to see what questions we get. All right, everyone. On that note, have a wonderful Friday. All the best to your flock. Everyone stay safe. And until next time, bye.